What is fentanyl? Fentanyl is a synthetic opioid medicine used to treat moderate to severe pain. It is up to 100 times stronger than other opioids like morphine, heroin, or oxycodone. Fentanyl is from the class of medicines called narcotic analgesics. What is fentanyl used for? Fentanyl patches are used for long-lasting pain relief for constant, around-the-clock cancer pain. Fentanyl nasal sprays, lollipops, injections, sublingual tablets and sprays are immediate acting and used for breakthrough pain. Breakthrough pain is when you have a flare-up of pain, even though you are taking regular pain medicine for chronic or persistent pain. Because fentanyl is a powerful prescription opioid, it can be misused, abused and cause overdose deaths. Fentanyl is classified as Schedule II under the Controlled Substances Act, CSA. Warnings: fentanyl can slow or stop your breathing, and may be habit-forming. Misuse of narcotic medicine can cause addiction, overdose, or death, especially in a child or other person using the medicine without a prescription. Using this medicine during pregnancy may cause life-threatening withdrawal symptoms in the newborn. Fatal side effects can occur if you use this medicine with alcohol, or with other drugs that cause drowsiness or slow your breathing. Before taking this medicine, you should not use fentanyl unless you are already being treated with a similar opioid pain medicine and your body is tolerant to it. Talk with your doctor if you are not sure you are opioid tolerant. You should only use or take fentanyl if you have your own personal prescription for this medicine. You should not use fentanyl if you are allergic to it, or if you have severe asthma or other breathing problems, or a stomach or bowel obstruction, including paralytic ileus. To make sure fentanyl is safe for you, tell your doctor if you have ever had breathing problems, sleep apnea, a head injury, brain tumor, or mental illness, alcoholism or drug addiction, urination problems, a seizure disorder, liver or kidney disease, or problems with your gallbladder, pancreas, or thyroid. If you are using fentanyl patches, tell your doctor if you have been sick with a fever. Having a high temperature can increase the amount of drug you absorb through your skin. If you use opioid medicine while you are pregnant, your baby could become dependent on the drug. This can cause life-threatening withdrawal symptoms in the baby after it is born. Babies born dependent on opioids may need medical treatment for several weeks. Do not breastfeed while you are using fentanyl. Do not change to another form of fentanyl, e.g. injection, skin patch, dissolving film, or lollipop device. If you switch from another form of fentanyl, you will not use the same dose. Fentanyl overdose and abuse. Although fentanyl is a legal prescription drug used for pain control during surgery and for chronic or breakthrough cancer pain, it is also being manufactured illegally, or legal prescriptions are diverted and fentanyl is misused and abused as it is sold for its euphoric effects. Street drugs like heroin, cocaine and methamphetamine can also be laced with fentanyl, also counterfeit drugs including hydrocodone tablets or Xanax. Users may not realize the street drug they are buying from a dealer contains this potentially lethal compound. Fentanyl test strips can be used to test if drugs have been laced with fentanyl. Fentanyl is extremely potent. This means just 2 to 3 milligrams of this drug can lead to death due to respiratory depression, decreased breathing, which can quickly lead to coma and death. In 2021 there were 71,238 fentanyl overdose deaths in the United States. Fentanyl side effects. Get emergency medical help if you have signs of an allergic reaction to fentanyl: hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Like other narcotic medicines, fentanyl can slow your breathing. Death may occur if breathing becomes too weak. A person caring for you should seek emergency medical attention if you have slow breathing with long pauses, blue-colored lips, or if you are hard to wake up. Fentanyl may cause serious side effects. Call your doctor at once if you have slow heart rate, sighing, shallow breathing, breathing that stops during sleep, severe drowsiness, feeling like you might pass out, confusion, extreme fear, unusual thoughts or behavior, or low cortisol levels, nausea, vomiting, loss of appetite, dizziness, worsening tiredness or weakness. Seek medical attention right away if you have symptoms of serotonin syndrome, such as agitation, hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness, twitching, loss of coordination, nausea, vomiting, or diarrhea. Serious side effects may be more likely in older adults and those who are malnourished or debilitated. Long-term use of opioid medication may affect fertility, ability to have children, in men or women. It is not known whether opioid effects on fertility are permanent. Common fentanyl side effects may include headache, dizziness, drowsiness, pale skin, feeling weak or tired, constipation, nausea, vomiting, stomach pain or sleep problems, insomnia, swelling in your hands or feet, increased sweating, or cold feeling. For patches, itching, redness, or rash where a patch was worn. Pregnancy. If you use opioid medicine while you are pregnant, your baby could become dependent on the drug. This can cause life-threatening withdrawal symptoms in the baby after it is born. Babies born dependent on opioids may need medical treatment for several weeks, so it is important that appropriate treatment will be available after delivery. Breastfeeding. Do not breastfeed while you are using fentanyl.